So is hypoglycemia always your priority? Okay, is hyperglycemia your priority? If you get a test question that said the patient's blood sugar is 600 and they are very hot, they're flushed, and they have abdominal pain. In the next room, you have a patient whose blood sugar is 40 and they're cold and clammy. Who are you going to first? Cold and clammy, okay? Because what do they need? Some candy. Okay, we got rhymes today. All right, so we're going to talk about hypoglycemia versus hyperglycemia and the difference between the two and how you treat it. The treatment for hypoglycemia is always on exams. It will be on farm ATIs. It'll be on this test. It'll be on finals. It'll be on everything. They love to test on this because you have to know this so that you can save your patient's life. You what? Oh, yes. Was it on a bunch of practice questions?
Yeah, it was a good on hypo and hyperglycemia. It's a good few. And then they did hypoglycemia and all the hypos and hypos.
Hypers, yeah, you got to know those really well. All right, hypoglycemia. Don't know what a normal blood glucose is. 60 to 100. It's the same as a heart rate, 60 to 100. Okay, so if it goes below 60, that is hypoglycemia. Now let's walk through what happens. What will happen to your body if you don't have enough sugar? Why? What's happening pathologically in your body? You don't have enough sugar to burn into ATP and energy for your cells. So your cells are dying. So as your cells start to die, your body starts to kind of freak out a little bit. Yeah. And then what happens? Why? Why do you go unconscious? So your brain cells are dying because there's no glucose to burn into ATP for energy, right? So how do you die of hypoglycemia? Well, actually, yes, you probably will die of MODS. Huh? You have no energy or function in any of your cells, right? Right? So your brain cells will die. The rest of your body is already dying, but it happens very rapidly. Yes? Okay. And the brain cells are so rapidly dying, and brain cells do not recover. Y'all know that, right? Once you kill them, they're gone. Okay, so don't sniff paint or anything because it's gone. Okay, so the brain cells will die, and you will eventually, yes, you'll start having seizures, and you'll go into a coma, and then you will die. And this happens very, very quickly, so you have to be ready for it. Okay. So without looking at your paper, what are some reasons why patients might get a blood sugar less than 60? What happened? All right, so let's say we gave them too much insulin, or they self-administered too much insulin, right? They counted their carbs wrong. Okay. What was the second thing you said?
Too much exercise, too little food.
All right, so when you exercise, remember we said your muscles are hungry for sugar, right? So you're going to burn off glucose very rapidly. Okay, what else did you say? I thought you said three things.
Yeah, too little food.
Okay, you just didn't take in enough carbs. So your body was producing the normal amount of insulin or whatever, but you just didn't eat. Yes? Anything else? Alcohol. Now, everybody thinks it causes hyperglycemia because y'all think fruity drinks or whatever, but that is not what happens. What organ is alcohol difficult on?
Pancreas.
What is hard on the pancreas is also hard on the liver, right? So your liver is working overtime trying to metabolize this alcohol. I remember your liver's got a big old pixie stick tower, right? Well, it ain't open. It's not open right now because it's trying to metabolize that alcohol, okay? So when a patient drinks alcohol, your liver basically gets frozen to metabolize it, okay? And it's not putting out any sugar, right? And a lot of times people drink instead of eating, right? So that's another reason why it might do that, okay? So alcohol causes hypoglycemia. This is very important, okay? That's why when you have a hangover, it feels good to eat a big old juicy meal, right? You want a big old nasty breakfast burrito.
So whenever someone drinks alcohol, the liver kind of like goes on pause for everything else.
Sure. So the liver has like 14 main functions, but it can only do one at a time. It's like our brains work, right? We can multitask, right? But they have done so much scientific research that says you are able to multitask, but out of that, you're only doing one thing really well, and the rest of it just kind of has to fall at the wayside, right? And we kind of all go through these cycles in our life where we do that, especially if you're a mom, right? Like there's sometimes like I am nailing the motherhood thing, but this place is going to hell. Or I am like, oh yeah, I'm killing it in the business, and then my kids are like, where's my mommy? You know, so you can only do one thing really well. That always happens to the liver. So when the liver is rapidly trying to metabolize it, you drowned it in alcohol, okay? Then it does not produce new sugar and it's not opening its sugar doors, okay? So it's very important for people to understand that, for you guys to know that, okay? Diabetic patients should not drink, okay? It will rapidly decrease their blood sugar, okay? All right. This is an emergency. This is life-threatening. Yes, they can die very, very quickly. So let's fix it. There are 3 sets of symptoms you will see. Okay, and I wrote them in order, and you need to recognize them at set 1, because by the time we get to set 2, you done waited too late, and it's going to be very difficult to treat. Okay, as soon as you don't have enough sugar, your cells are starving, yeah, and they start panicking. Okay, so you're going to go into a fight or flight response. What happens to your heart rate in a fight or flight response? It's going to increase. That is the first sign of hypoglycemia. What's the first sign of hypoglycemia? Tachycardia. This is very important to note, and I'll tell you why in a moment. They're going to start sweating, right? They've got diaphoresis. They're going to turn kind of a pale color because their blood is like shunting to other places that are absolutely vital to survive. They get very hangry. What's hangry? Hungry and angry at the same time, right? Because their body is like, oh my God, eat food right freaking now. Okay. And they're going to feel very tired because they have no energy. Yes. That's where we want to catch it, right? Because they're still able to be awake enough to treat. What do we give them at this time? 15 grams of a simple sugar. Okay. Give me some examples. 4 ounces of orange juice. For ATI, it's 8 lifesavers. I'm sorry, I ain't got time to be eating 8 lifesavers. Okay. Like, we're dying here. I'm going to be like, well, yeah, or just shove them all in at one time. But that is what they will say, and it's super stupid. So 15 grams of a simple sugar. I mean, that is literally like honey, icing, a pixie stick, okay? Something that your body will rapidly metabolize, okay? And then we follow that with a complex carb. What's a complex carb? Okay, so that's why we have graham crackers on the unit. If you've ever noticed, we always have those, okay? Because it still is carby, but it's a little bit harder for your body to break down. It's not straight sugar, so it'll last you a little longer. Because remember, we said what's going to happen. You give them 15 grams of a simple sugar. Blood sugar is going to go way up. Their body's going to produce insulin. It's going to come back down. So we need something to also kind of round it out. You with? Okay. Peanut butter crackers is also a very good option if you're not allergic to peanut butter, because that would be a bad option. Okay. If we did not catch it at that point, okay, the patient's going to start to get dizzy, weak, and confused. What is happening here? Brain cells are dying. Okay. Now at that point, are you going to be like, oh, I know that you can't keep your head up, but here's 4 ounces of orange juice. No, they will aspirate and choke and die. So you done missed your opportunity. At this point, you better pray to the Lord that they have this on hand. We will have that if they're in the hospital. Hold on to that for just a second. IM glucagon. They need to have this on them at all times, just as a patient with anaphylaxis has an EpiPen. Okay. It is a shot that you can give that rapidly gives them a ton of sugar that will metabolize very quickly. Do you understand? Okay. If they are in the hospital and they're admitted, then I would give them D50 IV push. It is in the crash cart. It is very thick like syrup. You find the port closest to the patient and you slam it as fast as you can. But when I say you slam it, I mean like most times when you slam something, you go like that with the syringe. But this is so thick, you go like this because it's like super duper thick. But you push it fast as you can. Do you understand? They will rapidly come right back up. Brain activity depends on how long that they were down, right? If it was a few minutes, they're probably fine and you have millions of brain cells, right? But if we find them on the floor 20 minutes after that happened, then yeah, I do not know what it's going to look like after that. If we do not catch them at dizziness, confusion, and weakness, then they will lose consciousness. They will start seizing because their brain's like, I'm dying, right? One last ditch effort. And they will go into a coma and they will not come out of it. Okay. If we wait till that point, you can give them all the sugar in the world and they may not recover because the brain cells have already passed. Do you understand? So mm-hmm. Those are for when they're unconscious, because they don't have to be conscious in order to have a shot or an IV push. But 4 ounces of OJ is not for unconscious. Okay. And also, please remember, don't pick diet soda because there ain't no sugar in that one. Okay. Not going to help anyone. Okay. So do we understand the treatment for immediate and conscious versus unconscious? Be very careful on exams to read, okay? Because everybody has had it hammered into them. 15 grams of a simple sugar plus a complex carb. Like, I could get that tattooed on my body. Like, I already know it, right? So your body's going to want to see hypoglycemia and pick that immediately, but you need to go and look, are they conscious or unconscious? Clear? Okay. In each semester, they like to test on something like a little bit different, but just to note, patients should also have a tube of icing and a thing of honey with them at all times because they can just squirt it in their mouth and move on with life. Okie dokie. All right. If they say, how would you teach a diabetic patient to prevent episodes of hypoglycemia? What might you say? Monitor your blood glucose.
Know what it looks like.
Okay, so know your normals for blood glucose.
And symptoms.
Eat at regular intervals. Think of all the causes. What are you going to tell them?
Don't
Don't drink alcohol. Don't skip meals. Have regular meals. Small, frequent meals. What else?
Bring something with you when you exercise.
All right, so before you exercise, you have to take your blood sugar. And your blood sugar has to be at least 100. Because if you go in at 60, you're going to burn yourself out, right? So your blood sugar has to be at least 100 before you decide to exercise. Now, if you're doing something intense like your 200-mile run, okay, I would want their blood sugar to be higher than that and to just hold icing with them the whole time to be like this. Okay, do y'all understand what I'm saying?
Yep.
All right. We can also make sure that they have a snack at bedtime because we need to talk quickly about hormones. Which hormone is secreted at nighttime?
Growth hormone.
Growth hormone. And with growth hormone also comes blood sugar. Right. Growth hormone and sugar go up together. So that's how your body sustains itself overnight and you don't die of hypoglycemia while you're sleeping because most of the time we don't wake up and eat a lot during the middle of the night. Well, unless it's finals. Okay. So that's what sustains your life. Yes. Okay. So most patients who are diabetic will take a dose of insulin at night because they can automatically anticipate that growth hormone is going to increase and their blood sugar is going to increase. Okay. But they can also do insulin plus a snack at bedtime so they don't bottom themselves out, right? Because we definitely don't want that overnight. That would be scary. Yes? What hormone is secreted first thing in the morning? What hormone helps you get out of bed and deal with the everyday stress of life? Cortisol. Your cortisol starts increasing somewhere between 4 and 8 in the morning to be like, girl, you got a stressful day and I'm here to help you. Okay. So the cortisol increases. What does cortisol do to your blood sugar? It increases your blood sugar, right? Yes, no? Okay. So you need to know the normal patterns of hormones and be looking for those times when a patient with diabetes might have increased sugar. Do we understand? So in order to prevent hypoglycemia, I would tell them, hey, when you take your insulin at night, just so we don't bottom you out, take a snack with it so that your blood sugar is maintained. Do we understand hypoglycemia? All right, let's move to hyperglycemia. Will you die? Okay, this is a blood sugar of greater than 200. Okay, why might you have hyperglycemia? You ate too many carbs. Okay, or you did not make enough insulin or your insulin was really crappy that you made. Yeah? Or you got the diabetes. Yes? And it's just not very well maintained. Yeah? Okay. What happens when you get sick? What hormone does your body secrete? Cortisol. What does cortisol do to your blood sugar? It increases. So times they are sick, we would expect a diabetic patient to have very high sugar. Okay. What are corticosteroids? They're synthetic cortisol and aldosterone. What does cortisol do to your blood sugar? It increases it. So if the patient's on corticosteroids for something, like they have bronchitis or something, what would you expect to happen? Their blood sugar is going to go up. What if you have a patient with type 2 diabetes who is admitted to the hospital with bronchitis on prednisone? They're diabetic. They are ill. What happens to cortisol? Then you gave them corticosteroids. What do you think the blood sugar on this patient's going to look like? It's going to be like 300, right? So depending on how poorly their glucose is controlled. So those are things that you need to know. You may have a patient whose glucose is very well controlled, right? And they're very good at taking their meds, but they got really sick in the hospital. We had to put them on steroids and they may need insulin for a period of time because their body is going under a major stressful response. Do we understand? So when I gave y'all that patient presentation, that should clue you in immediately. Watch the blood sugar. Okay? All right. So we have a rhyme for this one. What was the rhyme for hypoglycemia? Cold. For hypo. Cold and clammy, need some candy, right? So if their skin is cool and they're like sweaty, they need some candy. And hyperglycemia, their sugar is very, very high. Yes. And their body is going in overdrive trying to metabolize that sugar. Okay. Why would they be dry? Because the rhyme is hot and dry, sugar's high. How does our body try to get rid of this excess sugar? It tries to pee it out, right? And so you get polyuria. Poly means many. Urea means so lots of pee, okay? So they're peeing out a ton trying to get rid of all that excess blood sugar, right? So what's going to happen to their blood pressure? It's going to drop. What's going to happen to their heart rate then? It's going to go up. Do you understand? Okay. So they will have, in hyperglycemia, they will have polyphagia with the G. What is polyphagia with the G? They are very hungry. Why are they so hungry and eating everything? If you can't utilize the glucose in the cells, what do your cells think? They're starving. So they're like, girl, eat something, right? Okay. So you get very, very hungry and you want to eat everything. What is polydipsia? Why are they so thirsty? Number one, they're peeing a ton. Number two, their blood is very thick and viscous with all that sugar. So your body's like, let's just dilute this a little bit, right? You with? Okay. Why would a patient with hyperglycemia have blurred vision? Yes, it does affect the retina also. What is their blood like at this point? Very thick, very viscous. Okay, doesn't that affect their IOP, intraocular pressure? There's a lot of pressure behind the eyes, and there's a lot of sugar in the eyes. Yes, so it can cause blurred vision. Yeah. All right. Skin is hot and dry. Your body is in a massive metabolic state. Yes, and you've peed out a ton, so you're very, very dehydrated. Eh? Why might they have abdominal pain and hyperglycemia? Well, their kidneys aren't hurting. They're not dead. Well, that could be part of it. And their body is going through a massive stress response right now. Yes? Okay. In a stress response, you're producing excess cortisol. What is function number 11 of cortisol? If you don't know, I gave it to you on your paper. Function number 11 of cortisol. Increases stomach acid, which is going to burn, right? Okay. And they're in a massive stress response. So honestly, it can be very painful because your body's probably at this point producing a lot of prostaglandins. What are prostaglandins? Pain producers, because your body's an inflammatory response. You with? If we do not fix hyperglycemia, okay, type 1 diabetes will end up going into DKA. What is DKA? Diabetic ketoacidosis. And type 2 will end up going into HHS. What is HHS? Hyperglycemic hyperosmolar syndrome. Now they call it HHNKS, but I mean, what else? All right, so how are we going to fix hyperglycemia? What do they need? They need insulin. Okay, but first we're going to be like, listen, you got to change your lifestyle at this point. Stop taking in so many carbs. Okay? So the first thing we always do for every disease is lifestyle modifications. Yes? Okay. So we would tell them, hey, don't take in as many carbs. Eat at regular intervals, right? Let's take care of your body. They will need insulin for a period of time, right? Now, can you reverse diabetes? No. Yes. You toads can reverse diabetes because there's 3 ways that we treat it. First, we would tell them, change your lifestyle. If that didn't work, number 2, we would go to oral hypoglycemics, which is oral medicine. Okay. If that didn't work, then we go to shots of insulin. Can you go backwards? No. Yes. You totally can reverse it if you start taking care of your body better. Okay, because what happens in type 2, in type 1, it's a lack of that's a whole different story. Okay, but in hyperglycemia, we're typically more talking about type 2 because they're the ones who live that way, right? But the nerve damage can even be reversible because it's not usually nerves aren't regenerative, but diabetes doesn't ruin your nerves right from the get-go, right? The sugar just surrounds them so it can't conduct impulses. Right? Now, if you get to the point where they've got peripheral artery disease and they have cold dead legs, of course, yes, I cannot reverse that, right? But most patients, once they get diagnosed, can reverse it very quickly by going on a no-carb diet or a very low-carb diet, right? Now, remember, diabetes comes with a lot of comorbidities. So there's a lot of work to be done. So is it easy? Absolutely not. Because when your blood is thick and viscous, what happens to your blood pressure? It's going to go up. So they're going to have hypertension, diabetes, the 2 leading causes of cardiovascular disease and chronic kidney disease, right? Okay. So if they get to the point where they're in MODS, of course I can't help that. Okay. But anytime in that disease process, you could reverse it, right? By losing weight and managing your carbs and decreasing your blood pressure. Do you understand? And we'll talk more about how each of those fit into each other in just a bit. All right. Anytime they have really high sugar, they need to watch their urine for ketones. Once we have ketones present, what does that tell me? You're probably going into DKA, which happens a lot as soon as type 1 diabetics start to get sick. How come?
They aren't diagnosed.
Sometimes they're not diagnosed. But yeah, what happens when they're ill? Well, they do have a spike, a giant spike in cortisol. And what does that do to your blood sugar? Increases it dramatically. Can it get into the cell in type 1? No. So they're going to rapidly start breaking down fat, right? Which the byproduct of fat breakdown is ketones. Okay. So anytime somebody with diabetes gets sick, they need to watch for ketones in the urine. Do you understand? Okay. And if that's the case, they need to go to the hospital because they're going into DKA and they will require a hospital admission. What? It's a dipstick. I can't see them. Okay. All right. So illness and stress. What do they do to blood glucose? Increase. What does corticosteroids do to blood glucose? Increase. What does alcohol do to blood glucose? Decrease. I'm going to keep asking y'all that because everybody gets it wrong every time. Okay. All right. Do we understand the difference between hypo and hyperglycemia?